Hello, this is Dr. David Green, CEO of the Arizona Pain Network. The topic today is what you need to know about peripheral and diabetic neuropathy. There are 20 million people in the U.S. suffering from diabetic neuropathy and another 20 million suffering from the other types of peripheral neuropathy. Neuropathy is very simple. It involves damages to nerves that are outside the brain and spinal cord. So it's the peripheral nerves. There are three types of neuropathy. One is mononeuropathy involving one nerve. That could be carpal tunnel syndrome, cubital tunnel syndrome, tarsal tunnel syndrome. Polyneuropathy involves several nerves, the most common of which is diabetic neuropathy. Mononeuritis multiplex is the least common type of neuropathy, and that's where two or more nerves in different areas of the body are affected, for example, Lyme disease. The causes of neuropathy, there's quite a few of them. Here's just a few. Diabetes. That's the number one cause of neuropathy by and large, far and away. Alcohol intake, chronic kidney issues, liver infections, vitamin deficiencies, autoimmune diseases like lupus and rheumatoid, blood flow insufficiency, heavy metal toxicity, radiation or chemotherapy, infections like HIV or hepatitis, tumors, underactive thyroid, amyloidosis, and that's just to name a few. There's actually over 100. The symptoms of neuropathy will vary between patients. It could be mild or it could be absolutely disabling. Usually it's both lower extremities or both hands and arms. Early symptoms include tingling, burning, pins and needles sensation. And then when it gets to be more severe, it could be a really bad burning or a searing type of pain. It can make people depressed and feel isolated because it's very difficult for friends and family to even try and think of how bad this pain might be. If you haven't experienced it, you really just don't know. End stage, usually sensation is lost altogether. It just basically kills those nerves. Person can also have weakness, instability with walking, dexterity issues with trying to button shirts and handwriting. Organ dysfunction can also result in the bladder, cardiac, kidney. Treatments for neuropathy, number one is to control the inciting issue. If it's diabetic neuropathy, control the blood sugars. If it's heavy alcohol intake, control the alcohol intake. Medications can include over-the-counter nonsteroidal anti-inflammatories and Tylenol. Opiates can help control pain, along with neurogenic medications such as Neurontin and Lyrica. Pain creams can provide direct pain relief. Physical therapy and chiropractic treatment, along with TENS units. You see a TENS unit in the picture here. It's about the size of an iPod, runs on a battery, has those little foam pads that go on the skin, a little electrical current goes through for pain relief. And then if it's specific nerve compression of one or a couple nerve roots, then injections can be very helpful. Spinal cord stimulator implants have been a revolutionary advancement for neuropathy. The studies show that over 80% of patients achieve pain relief with them for neuropathy, and 85% of patients actually had improved sensation in their lower extremities, and this included 58% of patients who actually had their sensory deficits completely reversed. It's an outpatient procedure. It's relatively low risk. It's very expensive, but insurance does cover it. The surgical procedure that has become popular is the Delon decompression procedure, and that's truly a last resort. It's hard to completely reverse neuropathy. Usually you can sort of stop it in its tracks if treated properly. With the variety of non-operative treatments, the vast majority of patients are able to achieve a dramatically reduced level of baseline pain. And this allows individuals to increase their activities, avoid surgery. The top pain clinics in Arizona is Arizona Pain Specialists. They currently have 7 locations. They're a one-stop shop with board-certified pain doctors offering medical and interventional treatments, chiropractors, PT, spinal decompression therapy, acupuncture, a huge gamut of treatments at all the locations. They accept over 50 insurances. The pain doctors are board-certified. They have won the Patient's Choice Award 5 years in a row. The number to call for treatment is 602-507-6550, and the website is preferredpaincenter.com. I'm Dr. David Green, CEO of the Arizona Pain Network. Your pain stops here.